Okay, there we go. What we'll do is we'll talk about neurological diseases. So I just kind of just as an example. So dementia. So symptoms, we have memory loss, delirium, confusion, disorientated time and place. 日本語でも全然いいんですけど、この他の、認知症の症状とか、なんか思いつくものって皆さんありますか？大体これぐらいだったかな。大体これぐらいですかね。
I
あ、
have a
アネさん、
question.
Yes!
Yeah, in Japan, we call the word P, not PTSD. There's some four alphabet words, which
Mhm.
means the surrounded symptoms of dementia, not the main symptom.
Oh, okay.
I never heard that word in Australia while working in a dementia unit. So,
Yeah.
you know that word? Sorry, I forgot.
What's that? 4文字ですよね。It's a four-letter word that
Yeah,
explains.
the big
知ってる？
letters.
Big letters. 頭文字で、4文字で。
Sounds like
え
PTSD.
Sounds like PTSD. なんだろう？気になるな。So, sounds like PTSD, four-letter word. Um,
あ、
four-letter word.
that was
BPSD.
BPSD.
Oh, BPSD. What does that stand for? BPSD.
BP.
Behavioral and psychological symptoms of dementia. Okay, that's cool.
Have you heard this word?
No, first time. But I'm sure it probably is English, right? BPSD, BPSD. So it was behavioral and psychological symptoms of dementia. So behavioral 行動ですよね。And then psychological まあ精神的な and symptoms 症状 of dementia, BPSD. Okay. So non-cognitive, actionable, and treatable changes in behavior, blah, blah, blah. This is great. So, agitation. How many of you have heard of the word agitation? This is a very good word to know. First time? Oh, Arena? Oh, yeah, you've heard of it. Eminami, you have heard of it as well? Yeah, agitation. これ結構よく使いますね、agitation. なんか、そわそわするっていう感じが一番近いですかね、日本語では。A bit agitated, そわそわするとか、あとはなんか、you might become agitated and aggressive as well. You get quite, yeah, agitation and aggression. Aggression. So that's when you get, まあ、攻撃的ですよね。Agitation and aggression. So, BPSD. これ4つが behavioral and psychological symptoms of dementia で、4つ以上ある感じですね。Like, so there's more than four. So there's agitation and aggression, mood disorders, psychosis. So that's like delusions and hallucinations. Disinhibition, inhibition. So inhibition means like 抑制とかね、抑制、inhibit、抑制力。で、this って言ったらそれを、抵抗するので、抑制できない、disinhibition. Motor activity, so that means motor means moving. 行動の方ですね。motor activity. So wandering, so just walking about places, まあ、変なところにね、歩きに行ったりとか、pacing, pacing back and forth って言いますよね。So pacing back and forth. なんかもう、はっはっはっはっはっはっはって廊下のところとかね。ちなみについていけてないとか、ちょっともう一回それお願いしますとかあったら、いつでも止めてください。もう一度説明します。or repetitive behaviors. So もう何回も同じことをする。Have you ever seen なんかこう、具体的な repetitive behaviors 見たことある人いますか？私、多分、認知症の人とそんなに長いこと過ごしたことがないので、あんまり見たことないかなと思います。Yeah. なんか repetitive behavior 見たことある人いますか？もしシャイだったら、ここに書き込むのも全然 OK です。
認知症ユニットで働いてた時に、すごいたくさん見た気がします。
あ、へえ、どんな感じの、なんか repetitive behavior？
今なんかハイティングとか書いてましたけ
はい、
ど、
はい。
コレクティングって感じの人、
collecting？
なんか自分の部屋以外に全部の部屋入って、なんか人のものを持って、なんかうろうろしてっていうの
へ
が、
え。
なんかもうそれなので誰のものかわかんない、その
はん
人の
はんはん。
せいでわかんなくなっちゃうとか、あと
へ
は、
え。
まあ、アピタイトに関す
あ、
る症状
appetite？
だ
Yeah。
と思うんですけど、食べてもすぐに忘れて、ランチまだですかみたいな方と
うー
か、
ん。うんうんうんうん。
これがちょっとリピティティブかわかんないですけど、
Oh, yeah, I guess it could be repetitive. So if you had breakfast 1 hour ago and then you say, have it again, and
う
then
ん、
have it again, you're repeating breakfast again and again and again. That's repetitive behavior. Yeah, that's really interesting. Uh, what about sundowning? So increased agitation. なんかこう日が暮れると、すごいそわそわしたりとか、ね、こう、そういう風になってしまうって私も聞いたことあるんですけど、Does anyone have real life experience of seeing their patients, change or deteriorate? Deteriorate って言ったらね、悪くなっていく、deteriorate, in sundown. Um, any examples? I'm keen to hear. あれ、結構みんななんか、じゃ南さん。
Uh, I'm not sure it is the two symptoms, but one of my resident have the similar symptoms like a sundowning.
Mhm.
Her symptoms is really depend on the time, especially in her case, her cognitive is very bad, especially morning and nighttime.
Yeah,
So some
yeah.
of them, in the nighttime, she will be confusing about, especially having dinner or not. And also she will ask us about when will come back my family, or when will come my family, and they know I'm here, and
Yes.
she asked us very repeatedly, over maybe 20 times,
Really?
calculated a whole day,
Oh,
maybe.
yeah.
So I think I didn't know this exact name, the sound downing, but
Yeah.
when I heard this word, I think her symptoms is similar like this one.
Sundowning. Yeah. Thank you. Thank you for sharing your experience. I always think that it's the best way to learn things is always make it personal to you and your experience as much as you can. So whenever you think of a new symptom, you can think about like yourself or real experiences in your life where you've seen that, or then it's much easier to kind of remember and not forget. So yeah, no, that's great. I'll just put this in here. It's a bit long, but oh geez. And by the way, guys, feel free to sort of like add to this as well. So management, who here has worked with dementia patients before? So if you can raise your hand, those also Minami and Arena, yeah, you've worked. Oh, and Nanami as well. And then Yui as well. All right. So we have around about 4 people, 5 people who worked with dementia patients. In terms of management, what did you do apart from the daily care? Is there anything special that you did for dementia patients? I'm keen to hear.
In my facility, if the resident has the dementia and very hard to look after
Mhm.
them, like if when I provide hygiene care and they diffuse very strongly, like hitting, kicking, so looks like very aggressive,
Mhm.
we will go to their room with other staff. So it means to assist. Even she can work herself,
Yeah.
But it is possible to get some injury from them. So we will go to more than 2 stops, sometimes 3 stops we need.
So you would do 2 assist for agitated
Yeah, to assist
patients.
for patient. Yeah.
Yeah. I've also previously, when I was in living in UK, I've met with a psychological occupational therapist. So psychological occupational therapist, OT. I don't know what you call them in Japan, 精神科 OT. And then
That's interesting.
yeah, and he used to work with dementia patients where he would, bring out old, like, they'll bring out like old photos, right? And then like look back on their memories, or he will get newspapers from back in their days, bring it out and then read it together with them. And apparently it really helped, that sort of like, I guess, remembering the past helped stabilize them psychologically. Um, so stabilize patients psychologically, which I thought was really cool. What do you guys also know about how to engage with dementia patients? Even if you have never worked in dementia, just anything you know is fine. For example, I've never worked with dementia patients, but I know that you're not supposed to tell them, like, yeah, oh, no, no, no. Like, if they said, oh, where is my husband? You're not supposed to say, like, he's died or he's not here. Or, you're supposed to play by the like rules, I guess, by what they think. So that's one thing I know. What's other things like, any ideas about how to interact with patients with dementia? Um,
Yes.
yeah.
I think this is not coming any OET or other exam, but
Mhm,
I think this is the newest technique. Have
mhm,
you
mhm.
guys heard of humanitude?
What is it? New magnitude.
Minaminote.
I
Yeah.
mean,
I'm not sure, but this is the developed by the uh, some some doctor in Europe.
uh-huh.
Um, the basic of humanitude is firstly we have a greeting when we come into the room, and we look at their eyes so that
Mhm,
we don't scare them, and gently coming into the room, and we explain what we will do.
mm, mhm,
So some of our patients or clients, if they harbor very heavy behaviors, uh, as Minami said, they may refuse strongly the hygiene care or treatment what they need to take, but and they sometimes kick and hit to
mm,
staff. But if we use this way, so we greet properly and uh, talk to them what we will do,
mhm.
they can accept our cares.
That's
Yeah.
really interesting. Is it spelling correct? Humanitude?
Sorry, I don't know the spell.
Oh, humanitude. Humanitude.
あ
Sorry.
あ、
Humanitude. Like, humanitude. これね、多分ね、humane っていう言葉から来てるんですよね。So,
human.
humane means, humane, なんか、humane treatment とかっていうと、humane、人道的。So,
うん、
humanitude probably comes from that. Yeah, that's really interesting. So, humanitude. So, look at the patient in their eyes, greet properly, explain what you do to patients so that they can accept what's happening. That's really really cool.
so if you guys are curious, I want you to look up in the YouTube. So, when the staff member in the hospital treated the patients, he was very aggressive, but the teacher from Europe came to the patient. The patient was able to stand up and have a greeting very properly. I was so impressed. So
Really?
I
What
was
is it
always
called?
curious.
YouTube? What is it called?
In Japanese
Uh-huh.
pronunciation, we call it Humanitude.
あ、もうそれで出てくるんですね。ユマニチュードで、
Yeah.
で、ああ、
Actually, I've watched same video on YouTube, I
Mm.
guess. Yeah, I was so surprised because the patient how to say attitude was completely changed after the doctor attended the resident the patient.
that's really
Yeah, it's
cool.
very good. I think humanitude there are four key point. The one thing
Mhm.
looking at the patient, and also touching and
Oh, touching, yeah.
touching and explain very calmly.
Mhm.
And one other thing is the encourage to standing up.
Standing up. Okay, so
Yeah,
that's important.
I
I
think
wonder
these
why
four.
standing up. Is it because like meeting them at the same level, perhaps? Standing up, like
Uh,
shaking their hand, nice to meet you, that sort of thing.
mm, I think encouraging the standing up for just encourage like maintain their mobility, I guess.
Ah, that's really interesting. Okay. Humanitude. That's very
Yeah,
cool.
I
attitude.
tried this technique in Japanese hospital. For example, when I do oral care,
Mhm.
which oftenly be rejected by clients, they don't like this care, but it made a difference.
Really?
Yeah,
How
it's like
how did you how did you encourage to do oral care?
yeah. So usually, before I watching this video, I was thinking that I'm saying like, "Hello, I'm nurse. Let me clean your in oral care," and I thought the
Mhm,
patients understanding my explaining,
mhm,
but actually I realized that maybe they are not they will not be able to hear my explanation.
mhm.
So I made sure to uh, made sure that they are hearing my voice, and also I was being careful to make eye contacts. So and then
Ah,
that made the patients uh, understand my explanation.
that's really, really cool. So this was helpful also in, sorry, oral care as well. Oral
Yeah,
care is also humanitude, also helpful in oral care. So yeah, that's really cool. I think another thing that's also a common concern with dementia patients is restraints. これ日本語でなんて言うんですかね? Restraints.
we
拘
call
束?
行動制限。
行動制限 restraints.
Yes.
That's also a common. When I visited hospital in Japan, they were my friend works there, and then I asked to have a look. It seemed that it was in common use that they would use it quite often with the hand gloves, and then they would just tie it up to the bed and things like that. How is it in Australia? Is it not that commonly used, or?
I've just worked in a facility.
Mhm,
Maybe it's used in a hospital, but based on the learning in my certificate 3 school,
mhm.
maybe Australia is trying to be free from restraints.
Oh, okay. Australia is trying to be free from restraints.
Yeah, but
難しいですよね. It's a difficult issue, restraints. Yeah. What about your experience, Minami? Do you use restraints in your workplace?
Actually, I've never seen any this train in Australia. I also learned about this train in Australia when I went to my school, and also my teacher said, um, I think Australia medical place, they try to remove any restraint from them because it is the risk to injury the links. How to say?
Oh, wrists.
Wrist is yeah,
Yeah.
wrist and ankle as well. So, but actually, used to work at operation room in Japan, so I rare to see these kind of things. But
Mhm.
I when I went to Japanese world, I've seen several times the strained like the mitten, like
Yeah.
gloves and wristband,
Mhm.
and sometimes they are restrained from how say the looks like a belt.
Yeah, yeah, they would like tie you to the bed like with a
Yeah.
restraint sort of like
So
belt. Yeah.
yeah. So personally, compared to Japan, Australia is very strict. There is strict rule about the strain, I guess.
Mm. I guess there's a pretty different, maybe perhaps a very different value system. Oh yes, Nanavi, yes. What's your question? Oh,
So in Australia, I think we also have like IPS for the patient need to has a dementia or like unsettled.
mhm.
But in Japan, we don't have any human resource. So, and we do the restraint, I think. Because we don't have much human resource. Does it make sense?
What's IPS by the way?
Oh, so IPS for the person watch the patient 1-to-1, like one patient for one IPS. So
Ah.
normally we for the assistant nurse do
Mhm.
the IPS. So
Ah.
try them to redirect and reassure them you are safe in the hospital, you are in the hospital. So and you are on the treatment at the moment, so you can't go the home. And also in a patient has a high fall risk. We also
Mhm.
the IPS on the patient.
That's really interesting. So there's actually more carers in Australia, whereas there's not
Yes.
enough in Japan.
Mm,
That's really interesting. So high falls risk will also have IPS in Australia as well. So one-to-one care.
yes.
That's really interesting. Thank you. That was something new I've learned. I think there is just yeah, I don't know why they don't get more nurse assistants in Japan, but I've heard that one issue is that nurse assistants are not given enough autonomy. So like autonomy, so it's things that they can do by themselves. So they're not given enough autonomy so that nurses have to direct everything that nurse assistants do, which increases the
Mhm.
job for the nurses. And it would be better if the nurse assistants can do more by themselves. I don't know. I've never worked in Japan, but that's just one theory I've heard. But yeah.
Well, I see. I think in Australia, being a AIN assistant in nurse, we need to get the certificate 3.
Mm.
So, but in Japan, we don't need any certificate for assistant nurse.
Mm.
So maybe it's not proper way to sit on side to patient maybe in Japan.
Yeah.
So
So
the nurse should need to do that.
yeah.
So if I'm wrong, just let me know, everyone.
No, it's a very interesting theory like like it's a very interesting theory. Thank you. But how is it in your workplace, Yui?
Um, in my workplace, uh, but I'm working in home care, so
Mhm.
everything is different.
Mm. So you're always
But
IPS, yeah, one-to-one.
yes, but sometimes clients living with family, so
Mhm.
not only like one-on-one, but some client if the client is comfortable with me, but some family is not comfortable, like not suit with me. Sometimes it's difficult to like get good relationship with the family as well. That's why you but I never take care of the person who has a dementia in Australia yet.
Yeah.
I mean in home care, but like when I got a work placement, when I take certificate 3, I work in the facility, and then some people have the dementia, but like they are not like too aggressive,
Mm-hmm.
and then just like calling a lot, or
Calling a
like
lot, yeah.
or like how can I say that? Like have a math same in Japan. Like if pass like like not like nothing go, but like math, and then if she pass the math, like we cannot see it go out.
Yeah, yeah. なんかwhat is that called in Japanese? The fall prevention? 日本ではないですか？
なんて言うんでしたっけ？
fall mat? Is it like なんかアラームが鳴るやつですよね。なんかマットの上に足がつくとビーみたいな。Is that
そう
only in
です。
Australia? You've never seen that in Japan?
I have in Japan.
You have seen it in
But
Japan.
yeah.
Oh, that's really cool. Thank you. Thank you. Great. Yeah, does anyone have anything else to add about their dementia care experience, either in Japan or Australia or any other country? If not, I'm thinking what we might do is take about 3 minutes, なんか3分ぐらいちょっと時間をとって、次、パーキンソン病に移ろうと思います。で、パーキンソン病の話をする前に、皆さんね、多分これアクセスできるようになってると思うんです。もう一度ちょっとチャットに送りますね。で、これみんなで編集できるようになってるので、パーキンソン病の最初はあれなんですね、symptoms、症状とかだったり、あと etiology って言ったらね、etiology って言ったら、ちょっと待って、日本語の発症方法じゃダメだな。That's not a very good way of saying it. 病原学 etiology. So how it starts. So for example, etiology of dementia は Lewy body buildup in the brain とかですよね。なんかsticky things build up in your brain and that's how you get dementia. なんかで、
発症基準みたいな感じですかね。
それだと思います。ありがとうございます。So I think it's that. So symptoms and etiology and also management as well. So Parkinson's. So let's take around about 5 minutes to sort of みんなで書き込みましょう。で別にダブルアップとかあっても全然気にしないです。とにかく、自分の知ってる知識、私はこういうことパーキンソンについて知ってるよっていうのを英語でもいいし、英語がわかんないときは日本語を使って、書き込んで、5分ぐらい書き込んで、その後、それを見ながら、話していきましょう。で、書き込んだ後に、イニシャル入れてくれると嬉しいです。例えば、ね、アリナさんだったら、AH みたいな感じで入れてくれると、誰が書いたのかってわかるので、だからディスカッションの時に、みんなと話しやすいなと思って。で、also, like it's completely fine to make mistakes, and also write in your personal experiences as well. なんか自分のパーソナルな、それこそ my family, my auntie had Parkinson's とかでもいいしね。or my friend had Parkinson's or specific episodes, anything you know. specific エピソードとかは、ここのマネジメントの方に入れてもらったらいいかなと思います。So, personal episodes and management and personal episodes and symptoms and どういう症状があったのか。日本語と英語、どっちでも OK です。日本語だけで書いてもいいし、英語だけでも OK ですし。So let's take around about, wait, do you have any questions before we kind of like move on to taking 5 minutes to write? Any questions? 大丈夫ですか？ OK。 じゃあ、ちょっと、5分ぐらい。I'll just put a timer on for 5 minutes. All right. Ready, set, go. Alright. That's 5 minutes. どうですか書き込んでみて。なんか、意外となんか、こう知ってるなとか、意外となんかパーキンソン病について全然知らなかったなとか、なんか、どんな感想があるのか気になります。結構普通だった。OK。聞こえてますよね、みんな。よかった、よかった。オッケーオッケー。でもね、あれですよ、刺されてないとね、だから話そうと思っても、なんかなかなかどのタイミングで話したらいいのかみたいな、ちょっとこれからはもう少し、ピンポイントで、何々さんどう思いましたかって聞くようにします。So, thank you so much. So, we have shuffling gait. これ聞いたことある人、shuffling gait。聞いたことない人の方が多い。これです。なんか、shuffling gait って言ったらね、これ shuffle って言ったら、例えば、ベッドの中の移動とかでもよく言います。Can you shuffle a bit to the right? とか、Can you shuffle a bit to the left? なんかね、ちょこっと動くっていうのを shuffle って言うんですよね。shuffle up, shuffle down だったりね。だから、shuffling gait って言ったら、これです。ちっちゃい小刻みに、足をこうやって動いて、パーキンソン病の人を見ると、小刻みに歩くのと、あとは、それと同時に、stooped posture っていうのがありますね。So, stooped posture. So, shuffling gait. Another one is stooped posture. Stooped posture. これは、背中がこう曲がってるやつ。stooped posture. So, this is stooped. I'm stooped at the moment. So that's stooped posture. Tremor! これ聞いたことある人 Tremor。皆さん聞いたことある。OK, Tremor. これです。一瞬では。So when you're holding a spoon or something like that, and then it's very difficult to bring to your mouth. I think it was somebody in Japan who has invented a spoon that, that moves as you tremor. なんかね、so you can bring it to the mouth a bit easier. こうやって。So somebody, I think it was Japan, they invented that sort of spoon. Rigidity, rigid って言ったらね、硬いとか動かないとか。Rigidity、これはやっぱり、これ運動動作のこと言ってるんですかね、rigidity。日本語では何て言うんだろう。rigidity、構成。なんかちょっと違う気がするね。Parkinson's。
やっぱりなんか筋肉が硬いみたいな感じですかね。筋肉が硬くなっちゃう
多分そうだと思います。
rigidity。
Oh, rigidity. Yes, I think so. 筋肉が硬くなって柔軟性を失う。へえ、that's really interesting.
先生、リジリティとスティフってどう違いますか？
Such a great question. So, stiff. これはね、結構関節のことだと思うんですよ。stiff って言うとね。なんか、I have a stiff neck. Stiff. 例えば、I have a stiff shoulder とかって肩がね、もうthat's it. Like, これぐらいしか動かない。例えば、怪我した後とかね。After an injury, I have a stiff shoulder. で、rigid って言うと、難しいな。なんか、本当にでもなんか、stiff よりもっと動かない印象ですね、rigid。もっともっともっと動かない印象です。スティフはまだ動かせる。rigid だと結構、なんか、ちょっと、ロボット的な感じをイメージしますかね。rigidity。これね、正直ね、rigidity、英語で理解するのもちょっと難しいなと。rigidity in Parkinson's。すごい。This is such a good review for me. Rigidity or muscle stiffness is a common PD symptom that causes tightness and reduced range of motion in the arms, legs, or trunk. It can lead to muscle pain and achiness. Can result in reduced arm swing, facial stiffness. 誰か書いてくださってましたよね。これですよね。This is facial stiffness. So they have a very expressionless face. 結構あんまり表情が動かなくなる。So, facial stiffness. So slowness with movement or rest tremor as well. Yeah, I hope I've been able to answer your question. なんか stiff の方が日常的にもっと使います。my shoulder stiff. Rigid はそんなに日常的にはあんまりなんか、なんか rigid ってあんまり使わないから。あと、rigid は多分、その、動きに関して言うことが多いかなっていうイメージです。動きが rigid movement。動きが rigid。でも、関節は stiff joint。そんなイメージですかね。So this is rigidity is but if you're talking with people in everyday context, you use stiff a lot more than rigid. Fluctuation of symptoms in the day. これ知らなかったです。有馬さん ?First time. これ初めて聞きました、私。
I haven't searched, but in my memory,
Yeah.
it came up, I think.
That's really interesting. When is it better?
I think that in the morning it's very worse.
It's worse in the morning.
Yeah, and they take a medication in the morning, and gradually the effect is coming. So
It's
maybe
a
they
lot
are
better.
better in the daytime.
I also know that for the Parkinson's medication, you need to take it on an empty stomach. 何にもない時に you have to take it on an empty stomach for Parkinson's medication. I think so. I think levodopa was on an empty levodopa on an empty stomach. Let's see. Let's double check. Yeah, best taken on an empty stomach. This is the same as thyroxine for your thyroid, as well. So if you don't have, I think, enough thyroid hormone, you take thyroxine, and that's also in the morning on an empty stomach. So yeah, levodopa 1 or 2 hours before meals. And I think, yes, it does not cause death directly. So Parkinson's does not lead to, but you can imagine, 結構, a lot of people with Parkinson's, they pass away from, I believe pneumonia was the biggest cause, or fall, because you can see rigidity. If you have rigidity in your esophagus, it's esophageal rigidity, or if it, you start to have trouble swallowing and things like that, and that can lead to aspiration pneumonia. Aspiration. これ誤嚥性肺炎ですね。Aspiration pneumonia. So it can lead to aspiration pneumonia, and that can cause, death in people, or or maybe a fall is also another reason why somebody with Parkinson's might eventually pass away. So I think there is I wonder if you call it esophageal rigidness っていうのかな esophageal rigidity. これパーキンソンでよくあるのかなと思って。esophageal rigidity, but it's a common, often under-recognized component of gastrointestinal dysfunction resulting from the same muscle stiffness and slowness of movement that affects the rest of the body. So, yeah. By the way, if you have any questions, please stop me anytime. Yeah. So, esophageal 食道のことですね。esophageal rigidity in Parkinson's disease. It's common and often under-recognized. So, esophageal dysphagia. Dysphagia 聞いたことある人いますか？ dysphagia これね、dysphagia これです。塩化障害。これで私日本語初めて聞きました。塩化障害。dysphagia. So difficulty sort of swallowing. I might just copy this image in because it might be a little bit easier to remember. So dysphagia. That's good. Well, I mean, all of these words are excellent to know for OET. Aspiration pneumonia, fall, postural instability. So that means posture is 姿勢ですよね。So postural instability. Associated with dementia. これね、聞いたことあるんですけど、本当だったかなと思って。 Parkinson's. Parkinson's disease dementia, あるみたいですね, is a decline in thinking and reasoning that develops roughly 50 to 80% of people with Parkinson's. 10 plus more years in initial movement symptoms. それ、あれですね、デメンシャと同じで、Lewy body proteins in the brain, spread of that Lewy body proteins in the brain causes Parkinson's disease dementia. So, yeah, Parkinson's disease dementia. Parkinson's disease dementia is also a thing. I think it's caused by lack of dopamine in the brain. I'm pretty sure. I'm like 90% sure that it was caused by Parkinson's. I'm pretty sure. Neurodegenerative. So degenerative っていうと、degenerate どんどんどんどん悪くなっていくっていうあれですね。どんどん、like it's a it's a neurodegenerative. これね、ジョイントとかにも使うことあります。例えば、osteoarthritis とかも、that's a degenerative joint disease. どんどんdegenerate って言ったらね、元の形から崩れていくみたいな、そういうイメージです。So that's the image of the word degenerate. For example, osteoarthritis is a degenerative joint disease. Parkinson's is neurodegenerative. So もう元に戻ることはないっていうことですね。もうどんどん原型から崩れていって元には戻らない。neurodegenerative. Disorder caused by progressive death of dopamine producing neurons in the brain. So that's why. So that's why it's degenerative. もう元には戻らないんでね。So progressive death of dopamine producing neurons in the brain. So yeah, caused by lack of dopamine in the brain. So neurodegenerative process with progressive death of dopamine producing neurons in the brain. Smoking reduces the risk of developing Parkinson's disease. Did everyone know that? 知ってました? No, first time. そうなんですよ。私ね、パーキンソンはwhen I was in 大学にいた時にね、プレゼンテーションしたんですよね。And this is like 10 years ago. もう多分10年近く前になるんですけど、これでも覚えてるっていうのはやっぱりアウトプットってすごいなと思います。That I still remember like this like nearly 10 years from the time of presentation. So yeah, smoking reduces the risks of, so it's a protective factor っていうふうに言います。So it's a protective factor. Protective factor. It's more common in men. I'm pretty sure. これもね、ほとんどそうだと思うんですけどね。Pretty common in men. More common in men. Parkinson's. 確かそうだったと思います。1.5 to 2 times more common in men than in women. Estrogen is apparently protective. Potential protective effects of estrogen. So that helps protect the brain from Parkinson's. That's interesting. So yeah, 1.5 to 2 times. Depletion of dopamine, yes. There is no clear cause, but it's related to the neuron of dopamine in the brain is changed and cause a lack of dopamine to move the muscles. Yes, Nanami, thank you. And dysphagia as well. And let's have a look at the management and personal episodes. So this is my episode here. I had a patient with Parkinson's disease who used to go for a walk every morning. He has been doing that every morning for more than 5 years. I think he's still going on a walk every morning. He was from New Zealand as well. And yes, he was very structured and very organized. Never missed a beat. So I remember that. Deep brain stimulation. これ聞いたことある人いますか? これね、you insert like a なんかね、deep brain stimulation。これね、確かね、OET のね、なんかね、どこかで出てきてましたよ。なんかリーディングパート B か C とかでね、どっかでね、出てきたと思います。So that's deep brain stimulation.
これ患者さんに使ってる人いました。Sorry.
Oh.
Actually,
No, yes.
So one of the patient using like deep brain stimulation. So we turn it off in the night and then turn on in the morning.
Why do you turn it off at night? That's so interesting.
I'm not sure, but maybe they need to rest in the night.
Uh-huh.
So and then morning the patients need to, let's start moving in a daily life. So they put the start, they turn on.
That's so cool. That's really
But
cool.
not sure
ここからこう
because
ピッて。
I saw I know it has like a remote.
Remote, okay.
Yes, and then just turn it on and turn it off. It's yes, and I saw it in Australia, so I'm not. I should look up really deep, but I'm not not yet. But I don't know. I don't know why they turn it off, but I guess maybe patient need to have a less in the night, so just turn it off.
That's
Maybe,
really
maybe.
cool. Yeah. Let's have a look. Why turn it off at night? Conserving battery life, managing specific side effects, and in some cases, improving sleep quality. So yeah. That's really interesting. I've never seen someone with deep brain stimulation. I knew that it exists as a treatment, but I've never seen someone actually with deep brain stimulation. Thank you, Narami. So, pharmacological therapies following accurate time schedule, take levodopa medication, make marking on the floor to address shuffling gait. Oh, marking on the floor. Yes, actually, yes. ありましたね、有野さん。Yeah, the marking on the floor, and you say, well, step. How was that in Japan that you did that sort of treatment?
Yes, I really remember clearly that one of my senior nurse put the sticker
Mhm.
and maybe 4 or 5 from their bed to the toilet so
Mhm.
that they can recognize the marking and it. I don't know why, but it's really interesting. It can help their shuffling gait.
Yes.
Have you seen that?
Yeah. I learned that in university. I think there was also another one that was for like they get freezing, like a freezing. So then if you help them count, it can help. I think it was. Or
Yeah.
no. I think it was you break down the movement. Like you say, for example, like they get freezing. So like freezing, which is なんか体が動かせなくなっちゃうんですよね。なんか freezing. で、その時に、if you say, okay, now, like, I want you to extend your right hand, then they can do that. Okay, next, I want you to bend your knees. And then you say, okay, next, we're going to turn to the left. So you say one by one what you want them to do next. And they can do that movement, but they can't do that movement like on their own, if that makes sense. So, yes, that actually came back to me as a memory once you started talking about that marking. すごいいい復習になりますよ。忘れますね、こういうのもね、やってないとね。So yeah, freezing. So that helps breaking down the movement is a very good treatment option as well for that. So explain the movement one by one. Explain the movement one by one. Cool. Any other sort of episodes or anything anyone would like to add?
One thing I remember, like counting a rhythm, like 1, 2, 1, 2, when the patient's walking, maybe making the rhythm and they could easy to, start to walk.
Continuous rhythm, like 1, 2, 1, 2. So if you
Yes.
count, much
Yes,
easier
and
for them to
then
walk.
then I did the to the patient, and then the patient also take the rhythm and then start walking very good. So I really surprised. Oh, it's really walking.
Yeah, it's that
walkable.
easy.
So, yes.
That's really cool. Thank you. Anything else? All right. So I think let's make this one last one for the day today so that, I'm not keeping you guys up too late. So we'll finish around in about 30 minutes time, I would say. So that's my plan. Hence this one is, ちょっと待ってよ. I'm having a mind blank. これいつもレッスンで私これ言ってるのに忘れた。ちょっと待って。偏頭痛。戻ってきました。Migraine. So of course I have days like this as well. Migraine. なんか一回日本語で考えると、たまになんか英語が出てこなかったり、一回英語で考えると日本語が出てこなかったりすることないですか？ I feel like migraine, これもなんかいつも言ってる気がします。I feel like I'm saying this at least 4 or 5 times a week and then I still forget anyways. So let's take 5 minutes to jot down what we know about migraine. Sorry. いや、匿名シリマスさん、ごめんなさいね。 right. Thank you. I've seen some really interesting like things that I'd never heard of before. All right. How many of you これ読んでてなんか、それ知らなかったっていうのが、あるよっていう人手挙げてください。結構どうですか？初めて、私も結構初めてのなんか情報が多いなって感じがします。So, thank you, Nanami, as well. So more common in women. Yes, so migraine is more common. I'm pretty sure it's more common in women. Let me double check. Migraine is more common in women. I'm pretty sure I've heard of it. I've heard of it. Roughly 3 times more common in women. Okay, that's way more common than I thought it was. So roughly 3 times more common. So more common in women. So roughly 3 times more common. Sensitivity to light and sound. So it's different from a normal headache, isn't it? So normal headache is like, oh, my head hurts. I'll just take Panadol or ibuprofen for it. Migraine is like, no, no, everything has to be quiet. The room has to be dark. Don't talk to me. Like, it's very serious, a very, very serious headache. Hormones can affect migraine. So I think, hormones. It's considered a benign chronic disorder. So benign meaning like benign cancer or things like that. So it means it does not cause you to die. So it's benign. If you say でもなんかね、benign って言ったらね、なんか it's harmless みたいな、そういうニュアンスなんですけど、まあ実際にね、for somebody who is experiencing migraine, if you say to them like, oh, it's benign, that is like, it's not benign like, it's not benign as an experience at all, but it's benign as in it does not cause death. Yeah, and it's chronic as well. So it's a benign chronic disorder associated with aura. Has everyone heard of aura in migraine? がね、アタックが来る前になんか匂い、they have smell, they have a certain smell. Some people say they smell burning of like wood or things like that. So like, or they might see things. So they might see like colors, for example. So that's called like migraine aura. They smell or see things before the attack comes on. So they know like, oh, an attack is coming on because they get that sort of smell or vision. That my friend, she used to have really bad migraines, and she would get them every time she has a pink drink of any kind. I think it was the pink coloring that did not sit well with her. So every time she had a pink drink, she would get horrible migraines. And yeah, so and because she would get aura as well, she knows when it's coming on. So because she could smell or she'll see colors or things like that. So then she would have to, when she got it, she would have to go to her room and just not come out. But I think she also used to use migraine as an excuse not to come to school as well when she was fine. So yeah, she was like my best friend in high school, and I was always so frustrated because she would say, "Oh, I have a migraine," and she wouldn't come to school. But I always wondered how often she actually had migraine, whether it was all real. I think half of it was real, but other half of it she just didn't want to come to school. So yes, I was very upset with her because she was my only friend at school, and if she didn't come, I was like, oh, like you know, I was so upset, and I would talk to her on Skype because it was back in the Skype days. So yeah, we had Skype. Has everyone heard of Skype, right? Yeah, Skype, like not Zoom. It was Skype. But yes, headache when the weather is bad. Oh, M. Mutsumi? No, Mizuho. Is weather is what? これなんかどういうあれなんですかね？気圧？
多分そうだと思います。I'm not sure about that. but 確か気圧だった。
Yeah.
気圧って
Also,
どうやっ
that's
て言うかわかんない。
気圧, very good question. 気圧ね、ちょっと待ってよ。気圧。When what? ちょっと待って。It doesn't come up. Maybe I'm having a really bad brain day today. 気圧。 あんまりね、気圧の話ってオーストラリアとかでしないんですよ。なんでだろう。みんなします気圧の話。なんか日本、しますオーストラリアで。あ、結構するんだ。あ、しない。
日本だと結構なんか、頭痛がしだすと大体今日は気圧が低いからかなと
気圧。
か、
うん。
割と頻
言います
繁に
よね。
使います。
オーストラリアとかで気圧の話します？
オーストラリアでは、されてるかもしれないです。気圧って英語を知らないから、
いや、私、オーストラリアでほとんど気圧の話したことないかもしれない。
国民性なのかも
atmospheric だから、ていうか、そんなになんか気圧が自分の意識に入り込んでないっていうか、オーストラリアどうなんだろうそもそも気圧ってそんなに変わるのかな Like, does it change a lot?
Maybe in Japan it's more affected by atmospheric pressure
Yeah,
because we
言い
have
ますよ
many
ね。
rainy
うん。
days.
うん。
Yeah, yeah, I hardly talk about atmospheric pressure with my friends.
Yeah, maybe it's
Oh,
more our cultures in Japan.
yeah, maybe it's like a huge cultural, like it's part of like talking about the weather. You talk about the atmospheric pressure.
う
Um,
ん。
まあなんかこう、なかなかこう、実感しにくいことなのでね、atmospheric pressure. It's hard to tell. But yeah, atmospheric pressure. Thank you. So headache when the weather is bad. So maybe atmospheric pressure. Atmospheric pressure can affect it as well. Vomiting. You know what? I'm starting to think that 日本語で考えてたりすると、なかなか英語が出てきにくいなってなんか思いました。英語で考えてる方がなんか英語がスムーズに出てくるっていうか、so like Japanese really interrupts my English. So if I say 偏頭痛ってあるとなんか英語がなかなか出てこないみたいな。So yeah, it's I don't know. Anyways, vomiting, yes, it can also be accompanied by vomiting. So you can get quite bad vomiting as well. Some patients feel the sense of warning that symptoms will occur. Yeah. So that's like the aura we talked about. It's good time to take the medication. Yeah. Throbbing pain on one side, sometimes both sides. Yeah, you get really bad pain. I've never had migraine, so I don't know. And it's connected to the weather. Yeah, thank you. I think that's like pretty much like the big parts about migraine, the big symptoms. So there's medication for migraine, but I heard it also affects the heart at the same time. So I think it causes tachycardia, so it causes your heart rate to go up. I'm pretty sure. Migraine medications, does it cause tachycardia? Yes. So certain migraine medications can cause tachycardia. So triptans, apparently, these are known to cause chest pain, pressure, and palpitations. While often benign, they cause tachycardia, palpitation, in rare cases, arrhythmia. I remember it. I remember this so clearly because my friend who had severe migraine, she really suffered from it. Her parents told her that she cannot have the medication because of the side effects. And I thought that was, I don't know, I still don't know how I feel about that because if your kid is suffering from migraine and the doctor has prescribed medication for it, and then the parents have thoughts about the side effects, parents shouldn't then decide whether the kid gets to have the medication or not if the kid wants to have the medication. So she was like 16 or 17 at the time. She really wanted the medication for the migraine, but her parents said that she cannot have. And because she was 16, 17, she couldn't have. And I thought that was really unfair. So I was really upset at her parents for being, I don't know, being that way. So yeah, but as being underage. So my friend had it in high school, yes. Painkiller is effective for migraine, but we need to care about asthma and 前立腺肥大。prostate hyperplasia。それ知らなかったです。prostate hyperplasia。みなみさん、初めて聞きました。
なんか私も詳しい記事まではちょっとよくわかってないんですけど、その N サイズは、 その、気管収縮につながるのと、その尿閉って言って、ただでさえ前立腺肥大だと膀胱の下のその前立腺が肥大していることで、おしっこが出にくい状態なのに、多分膀胱括約筋かちょっとどこの筋肉が正確か忘れちゃったんですけど、その筋肉をさらに収縮させちゃうから、そのおしっこが出ない尿閉につながる可能性があるから、NSAIDs は、そう、喘息と前立腺肥大の人には、近畿だった。近畿じゃないかな。なんか、注意しないといけないっていう。
That's really interesting. So, like NSAIDs is not that good for people with asthma and also benign prostatic hyperplasia. Prostatic hyperplasia. Benign. So again, that means it doesn't kill you. Oh, that's really interesting. NSAIDs for asthma. なんかね、これもなんか昔聞いたことあるけど忘れてたような気がします。NSAIDs for asthma. Can trigger severe, potentially fatal asthma attacks in 7 to 10% of adults with asthma ってありますね。Aspirin, ibuprofen, naproxen. So NSAIDs. 知らなかった。I'll say. NSAIDs, like aspirin, ibuprofen, naproxen. Naproxen ってね、日本では全然聞かないけど、で、イギリスではほとんどみんななんか naproxen 取ってました。なんか every second person that comes through the door is taking naproxen. 日本でもナプロクセンってあります？あんまり聞かない。
あるけどあんまり聞かないですね。
ああ、結構もうイギリス、ナプロクセン大好きですよ。every second person, every GP is like, oh, you have pain? ナプロクセン。なんか、日本ではなんか結構お医者さんからもあれ、アセトアミノフェンとかね、the things you can buy over the counter なんか prescribe されることが多いなと思うんですけど、処方されることが多いなと思うんですけど、I think in the UK, the thought is that they're not going to prescribe you things that you can buy over the counter. They're going to prescribe you something a bit stronger because they think that if you're coming to me with pain, then it's probably you already tried paracetamol, ibuprofen, it's not working. That's why you come to the hospital. That's why I'll give you something stronger, like naproxen is how they think, I think. So yeah, everyone has naproxen. みんな naproxen 取ってましたね. So yeah, naproxen can cause, yeah, severe, potentially fatal asthma in 7 to 10% of adults with asthma. Asthma. That's really interesting. Something I learned also recently as well was that asthma death, about 10% of asthma death is caused by mild asthma. So they don't have severe asthma. So people with mild asthma, around about 10% of them can pass away from an asthma attack. So even if you have mild asthma, it's not severe, you still should be careful and carry around puffer with you and things like that. Because about 7 to 10% of asthma death is caused by mild asthma, not severe asthma. それ聞いた時にね、びっくりしました。って思って、マイルドでも結構気をつけないといけないんだなと思って。So yeah, that was quite interesting as well. Alrighty. So that's pretty much the end. 8時半ぐらいまでかかるかなと思ったけど、意外と早くできましたね。Any 進め方とかで、一応これ今回初めてだったんで、これは本当に模索中なんですけど、サジェスチョンとか、ここ良かったとかでもいいですし、ここをもう少しこういう風にしたらディスカッション盛り上がるんじゃないかとか、なんか、コメントっていうかありますかね？Does anyone have any comments about or any interesting things you learned today as well? Yeah.
Thank you so much. It was very good chance to output our knowledge, medical knowledge in English because when I was studying for NCLEX, I was able to read and understand their English sentences, but it's really hard to explain about their mechanism or symptoms in English. So if we could pick up many topics in 1.5 hours, which is very helpful. So I would like to suggest filling our ideas before this time, and then
Oh,
just
okay. Yeah.
discuss in this 1.5 hours.
That's great. Yeah, that's fantastic. And then, what do you think about like sort of like ways to get people to present? なんかどういうふうにこう話してもらうのがいいんだろうなと思って、なんかこう順番で話すとか、なんかどういうふうにこう、どういう形でアウトプットしてもらうのがいいのかなと思ってて。
うんうんうん。
Any ideas?
うーん。
どうだろう、なんか事前にフィルアウトしたとして、例えば、じゃあ、次、転換脳卒中、脳震盪、小児麻痺あるじゃないですか。では、そこで、同じように、こうドキュメントで、みんなそれぞれ知ってる。別にダブルアップとかしても全然、問題ないというか、だから、that's, like, fine to double up. So, like, what you know about it. なんか知ってることをアウトプットしてもらって、で、そこから、じゃあ、当日、じゃあ、ディスカッションするってなった時に、どうなんですかね。なんか、今回とかは結構私がメインに話してたかなと思うんですけど、解説しながらとか、なんか次回も私がメインで話す系がいいのか、それともなんかもう少しこう参加者がこう話せる機会がもう少し多いの方がいいのか、どうですかね。
そうですね。話してもいいです
あ、
か？
はいはい、もちろんです、もちろんです。
私、今回のその脳神経学、そのデメンシアとかパーキンソンとか、私あんまりそういった患者さんに出会うことがほぼほぼなかったので、今日すごく勉強になったんですけど、全然知らない単語ばっかりだった
うん
し。なんで、得意な人、不得意な人がいるような気もします。例えば、ここの科目はめちゃくちゃわかるけど、
うんうん。
例えばこの科目はわからないとかっていうのはあると思うんですけど、なんで、そうですね。事前にフィルアップするのは、フィルアウトするのは、その勉強にはなるかなとは思います。そういう、こういうの知らないから
うーん。
と思います。
フィルアウトっ
はい。
て、じゃあどうですかね。日本語でフィルアウトしてもらって、それを当日英語で話すっていう方がいいですかね。それとも英語でフィルアウトの方がいいんですかね。
英語ですかね。
英語で、英語でフィルアウトして、当
はい。
日それについて、私も含めみんなで英語で、それについてディスカッションするっていう形がいいですかね。
うーん、そうですね。ちょっといいアイデアが思いつかないです。それぐらいしか。
いやいやいや、でもなんかやっぱり試行錯誤っていうか、でもそれこそ、いや結構、ここういう形でやってみようかなって思ったきっかけも、やっぱり、症状の名前とかはね、症状の名前とか、パーキンソンっていうのは英語で知ってるけど、じゃあその症状までは知らないとか、症状をじゃあどういうふうにそれを表現していいのかっていうのは、そこまではちょっと難しいっていう方が、なんか結構多かったので、で、やっぱりね、リスニングパート B とかパート C とかでもしっかりと答えられるように、スピーキングでもそうですけど、やっぱりしっかりと自分でさ、説明したりとか、ね、例えば、じゃあ、デメンチャだったら、explain to patient's sister about, なんか、what dementia is とかがあったりとかしたら、やっぱりそれをしっかりと自分の言葉で、じゃあ、スピーキングで説明する。で、リスニングとかでも、あの、特にパート C とかですよね。専門家がそれについてすごい言ってるときに、ある程度の背景知識があるとないとでは、So we brought Parkinson's specialist, Jesse Smith to talk to us about Parkinson's disease みたいになった時に、パーキンソンについて、やっぱり自分自身がどれだけの知識を英語で持ってるかっていうのが結構大事かなと思ってて、日本語では役に立つとは思うんですけど、ある程度、例えばシャッフリングゲートとか知らなかっただけで、急にシャッフリングゲートって出てきたら、何や、その話みたいな感じになると思うので、ステップポスチャーとかもそうですけど。 あとはデメンチャとかでもデリリアムって出てきたときに、デリリアム知らないな、みたいな。だからやっぱり、デメンチャを知ってるだけじゃ足りないなっていうふうに思ってて、でもパーキンソン知ってるだけじゃ不十分。で、こういう機会があると、もっと深く英語でその知識がアップデートできるかなと思って。So yeah, let's give that a go then. We'll try with that. なんか本当に試行錯誤しながらっていうか、皆さんの意見とかも取り入れながら、まあでも一旦じゃあその事前にフィルアウトしてもらって、でそこでこう3人ぐらいこう一つのあれにピックアップして、じゃあはい。この人、この人、この人で、なんかちょっと自分の書いたことには同じようにイニシャルしてもらって、自分の書いたことについてもう少し詳しく、英語で、elaborate してもらうっていう。あと、まあ、で、本当に、まあ、パーソナルなエクスペリエンスとかはもうすごくめちゃくちゃウェルカムです。So it's really welcome to have very personal experiences. Because I think that's just like, まあ、今、これからの AI 時代ね、どんどんどんどん自分の、こう、個人的な経験、個人的な体験とかっていうのがもっと聞かれるようになるかなと、はい、思うのと、あと、まあ、それが一番脳に、記憶に残るかなと思うので。So, yeah, that's all good. All right. Before we go, is it okay if I take a photo? And if you're a bit shy, feel free to like this, like this. Okay. All right. はい。ありがとうございます。はい、チーズ。Thank you. But yeah, it was really interesting to learn. So I was really interested to learn about the asthma. Let's finish off with one thing that you found interesting. So I'll start with me. I was interested that asthma and NSAIDs, like I was interested to learn that NSAIDs is not really recommended for asthma patients. So that was something that I learned that was really interesting today. Let's next go to Yui. You look very sleepy. Thank you for joining.
Yeah, because I wake up 4:30 every day.
Oh my gosh, 4:30. Thank you so much for joining. What, what was one interesting thing you learned?
What's interesting, like so many, like maybe everyone was nurse or like support worker in Japan as well, and they have experience in Japan and in Australia, and then like some episode was like really interesting for me, and it's like how can I say that? I'm not trigger. なんて言うんだろう。なんか思い出すきっかけになるエピソードが多くて、なんか
Yeah,
記
it
憶
helps
の
you
定着に
remember.
なるかなって思いました。
Yes, 思います。なんかそういうね、エキストラのエピソード、例えば、それこそ私が友人の話をしたのとかも、なんかマイグレインで親がね、許してくれなくて薬を飲んだかんとか、そういうall that sort of extra information that makes them personal really does help to remember and recall the information, I think. そこからこうつながっていくっていうか、yeah, so I think that's personal episodes are super welcome. Yeah, no, that's great. Thank you.
Thank you.
Next, Mizuho, what did you learn today?
I learned a lot of things from this lecture. Um, 他に、そうですね。So yeah, I needed to review one again about this lecture because I couldn't follow up all of this. So that's it.
Yeah, no, thank you. Thank you. Yes, it was very interesting. Perhaps like it was a bit early on. でもなんかあれも面白かったですよね。なんかで、IPS だったっけそのオーストラリアでは1対1で、like, care worker can work with dementia patients one to one, whereas なんか in Japan,
はい。
not enough nurses. So that's why we tend to use restraints in Japan, whereas we don't in Australia. なんかそれも面白かったですよね。That was quite interesting. Next,
そうですね。
thank you so much, Mizuho.
Mhm.
Yeah, no, thank you. All right. And Arena, what did you find interesting?
Actually, I was working in a respiratory medicine and general medicine mixing unit in Japan. So, like the Parkinson and the dementia should be my professional, but
Mhm.
I just realized that I'm forgetting many of knowledge, so I
Me
was
too.
a bit sad. Yeah, and also I have to remember the knowledge, and also I have to speak in English, so I'm feeling a bit overwhelmed.
Yes, yes, me too. I completely forgot about the Parkinson's like timing, and then also the marking. なんか知ってたけど忘れてました。で、今日聞いて、あったな、そういえばみたいな、なんか you forget if you don't practice. So it's actually such a good review.
Yeah,
すごく良かったです。
yeah, this is very
Thank you.
good practice. Thank you so much.
Yeah, no, thank you. And lastly, Nanami, what left an impression on you?
Well, I really surprised if the migraine has a patient has a migraine, they notice like aura, like smelling and lighting. I never heard. I'm not. I never explained the migraine, so I didn't know it has happened. Like they know. Sometimes they know that what they it comes. So I feel like, wow, it's really interesting why it happens.
Yeah, no,
For
it's
the
super
aura.
interesting. Yeah.
Yes. And then at the moment, I work in a neurosurgical ward. So I know that a person from has a deep brain stimulation. So that's good opportunity to discuss about it. So I really enjoy and then learn a lot of things this meeting. So thank you.
Wonderful. Great. Thank you so much, everyone, for joining. And then next week, I hope to do the same as well. And then, with feedback, I am, planning to be very flexible about how I run these sessions. I want it to be very helpful. So initially, it started as a self-study sort of time. If you find that sort of traditional OET lectures helpful, I might include that, like maybe say every なんか2、3回に1回ぐらい、その OET のなんか伝統的ななんか traditional OET lecture みたいなのも、やっていきたいなと思います。で、また、if there is like demand for that. そういうなんか、そういう伝統的なレクチャーやってほしいなっていうのであれば、どの科目がいいかっていうのも、また後で LINE で教えてもらっていいですか？この科目がいい。もう一回リーディングが良かったらもう一回リーディングで、例えば、サンプルテストから取ってくるんでもいいんですけど、ただ教科書からね、私がリーディングのマテリアルを取ってきたら、一応、皆さんにも教科書を、ご自身で購入していただく必要があって、コピーライト的にね、私がマテリアルをシェアしてるような感じになっちゃうので、like、リーディングとかだったらサンプルテストから取ってくることが多いかなと思うんですけど、教科書から取ってくる際には、皆さんにもその教科書を手に入れてねって、お伝えする感じになります。So yeah, if you want me to do reading again, happy to do reading again, or listening, speaking, writing, any subject is fine. So yeah, do let me know in line what you prefer. So I'm planning to be だから、だいたい今のところ、はい、3回に1回ぐらい OET の伝統的なレクチャーを挟んでいきながらやろうかなと思ってます。So yeah, cool, wonderful. Thank you so much for coming. And yeah, you guys make it come true. So if nobody turned up, then I wouldn't know what to do today. So thank you so much for coming. And yeah, have a lovely night. And I'll see you guys next week.
Thank you
Thank
so much.
you. Bye.
Thank you so much. Bye.